Jeff Mason, White House reporter for Reuters, who's usually in Washington but is here in New York with us. Jeff, great to see you.
Good to see you,
in
Eric.
person. Obviously, this rule is aimed at trying to keep people out by excluding those who can't pay for health care.
Yes, but I think one thing that's worth really making clear here is he's talking, this rule, and the president and the White House here are talking about legal immigration. These are people who are applying for visas to come, eventually perhaps get a green card to meet up with family members, but they're doing it legally. So the White House has had kind of a two-prong approach in its immigration policy. Certainly trying to cut down on illegal immigration, that's the president's promise to build a wall, but also to curb legal immigration, and that has stirred some controversy.
That's an important point there. About 535,000 or so people, it could affect them every year. So these are legal immigrants who apply for visas, and you have to show that you can have your own health care or can pay for your own health care before they grant that visa.
That's right.
Even though this is the legal process.
That's right. And I mean, the president, and in particular his top immigration advisor, Stephen Miller, are really eager to reduce the burden of costs that immigrants place on the United States, or that they view as the costs that immigrants are placing on the United States, including in health care.
Yeah, they mentioned that in the proclamation. Let me just read that to you now.
Sure.
This is part of the proclamation. It says, quote, "The costs associated with this care are passed on to the American people in the form of higher taxes, higher premiums, and higher fees for medical services. In total, uncompensated care costs, the overall measure of unreimbursed services that hospitals give their patients, have exceeded $35 billion in each of the last 10 years. These costs amount to approximately $7 million on average for each hospital in the United States. It's going to drive hospitals into insolvency." You know, the White House has $35 billion a year. Can we quantify that? I mean, there has been talk. It is a crushing amount.
It is a crushing amount, no question about that. But they don't specify here that that $35 billion is just referring to immigrants. They're talking about all reimbursed care. So I suspect that means not just immigrants who are here legally, but also other American citizens who don't have health care. And ironically, as we were talking about a little bit before, that's the same argument that people who are arguing for universal health care, also for Obamacare when President Obama was in office, made for having a broader health care coverage, was to be sure that you don't have these costs from people who are showing up at hospitals and emergency rooms without health care.
And there is that fear, at least some. Is it based in fact that people try to come here to take advantage of our government health care system?
Indeed. And that's just a debatable fact between the two sides on this issue.
The health care advocates call this draconian. You're certainly going to see probably challenges in court. What do you expect along that legal line?
I think so, and that's sort of been the precedent for a lot of these things, is that they end up in court. It also doesn't give a whole lot of time to people who are working in consular offices around the world to come up with or to study and figure out what the criteria will be, because it'll be their job going forward, if this proclamation does go into effect in November, to test or require the people who are applying for those visas to show that they can pay for their health care.
And finally, do you know how people, what they're going to do? Show up and get a visa and say, look, this is my health card? How does it work? Do we know?
Apparently, the State Department is going to set out some guidelines, but I haven't seen those yet, and I imagine the people in the embassies and consulate offices around the world are eager to see them too.
Well, you could ask the president next time you see him. I would be utterly remiss in my professional responsibilities if I did not praise your diligence, your dedication, and you just kept on with those questions the other day with the president, and you got the president of the United States yelling at you in front of a few hundred people, your colleagues and others, and millions on television watching. Here's how Jeff Mason, some say this is a tutorial in journalism for journalism schools, handled a president who was yelling at him. Here it is.
The question, sir, was what did you want President Zelensky to do about Vice President Biden and his son, Hunter?
Are you talking to me?
Yeah, it was just a follow-up of what I just asked you, sir.
Listen, you ready? We have the President of Finland. Ask him a question.
I have one for him. I just wanted to follow up on the one that I asked you, which
Did you hear
what
me?
Did you want
Did you hear me?
Yes,
Ask
sir.
him a question.
I will, but
I've given you a long answer. Ask this gentleman a question. Don't be rude.
No, sir, I don't want to be rude. I just wanted you to have a chance to answer the question that I asked you.
You were cool, you were collected, you were professional. What was going through your mind at that moment as it was happening?
Thank you for saying that. I think what was going through my job was just, what going through my head was just do your job. And that's what I was trying to do. He didn't answer the question, and I wanted to follow up, and followed up a couple times, and that's our job in those situations.
Do you ever see him at other times? Does he talk to you or say anything to you? I mean, what type of relationship, if any, do you have with the president?
Not since, well, he knows me. I mean, he called me because he called on me that day because he knows me, and I haven't had a chance to ask him a question since then. I was traveling on the day after that press conference to Florida, but the president didn't come back that day to talk to the pool on Air Force One, so we haven't seen each other since. But look, he has had opportunities to yell at other journalists before and moves on, and I'm sure that he'll move on, and I'll move on from this as well.
Yeah, Dan Rather, remember Dan Rather, Richard Nixon, the President Nixon said, "Are you running for something?" And Dan Rather stood up and said, "No, were you?" I mean, that was, you were not rude in any way. You just were diligent and kept on asking to try to get to your point.
I appreciate that. And I think that's our job. It's our job to do follow-ups, and it's not our job to grandstand. And I wasn't in that case.
No long TV-type questions from this journalist, Mr. Mason. You are a class act.
Thank you, sir.
Thank you. Thank you. Jeff Mason of Reuters, White House correspondent. Mr. President, say hi to him or something next time. Thank you, Jeff.
Thank you.